Welcome back to Growth Without Barriers. I'm Andrew Sherman from Jones Day. I'm here with my co-host Karen Kerrigan from the SBE Council. We want to thank AT&T again for their support of this webcast. We've been talking about the elections and the impact of the elections on entrepreneurship and small business, and what do the candidates have to say with only 30 days away around a variety of issues. And certainly one issue that has been on everyone's mind for probably the last 2 years, if not longer, has been healthcare and the impact of the passage and then the Supreme Court's upholding of the Obamacare, give it its full name, and what will that mean after the election in terms of some of the implementing regulations and the costs and burdens on small companies.
Yeah, and we can say Obamacare, they're embracing that now.
Yeah,
and before,
right.
Members were like, well, that's derogatory, on his side of the aisle.
Brand it now,
but now, no, it's on his website, and they're fully embracing Obamacare. So, or the Obamacare label, let's just put it that way. But you're right, I think this healthcare issue is a major concern, or has been a major concern to small businesses. I know we've been surveying on this issue. We have members who have visited with Congress, who have testified before Congress, and said, look, this is an issue that's really, again, one of those issues that's driving uncertainty and that's causing us to have low confidence in terms of the future, because they believe their costs will continue to go up and not down, and the facts bear that out. Healthcare costs continue to go up and not down. And they're very concerned about being able to keep the insurance that they currently have, or the insurance that they currently provide, because we know the government said that most small businesses won't continue to be able to provide the insurance, give the insurance they currently provide. And they're obviously very concerned about costs. I think that's the number one issue. So, we've been doing this series of a look at the candidates and where they stand on issues in small business, and looking at the Obama platform as well as the Romney platform and where they stand on issues. And if you go to the Obama site...
I guess they're not the same.
Well, if you go to the Obama site, they fully embrace Obamacare, and that's not surprising. They continue to point to a couple of things that will help small business owners and self-employed and individuals, and that's the healthcare exchanges, although those do not exist yet, and we have some concerns about how they're being designed right now and whether they're really going to give small business owners affordable choices. And they do tout a lot of things. The small business tax credit, even though that tax credit really has been a failure compared to what the administration... Well, in terms of what they said it was going to be there. They said 4 million small business owners would be eligible for the credit. The GAO did a study that found that only 170,000 small business owners actually qualify or use the credit, and only 28,000 used the full credit at 35%. Wow. And what they found, surprise, surprise, that it was too complex, that it was, just too restrictive.
Not enough communication about how it worked.
Well, not really. No, not at all. What they mostly found is that it was too restrictive. A lot of small businesses could not qualify for it. It was too complex to use. And that 35% tax credit wasn't enough oomph, if you will. It wasn't enough, incentive for businesses to actually go out and purchase health coverage if they couldn't use it. It's 35%, so it was rather meager. So the Obama, Obama in this campaign is touting the many benefits of Obamacare. On the other hand, you have Romney in his platform. He said on his first day in office he would grant a waiver to states, and then he would work with the Congress to repeal the entire law. And in its place, there's a couple of things that he wants to do. One would give tax parity for individuals, that meaning individuals would have the same ability to deduct, their health premiums from their taxes like large corporations do. It would create he would create a national marketplace for health coverage. That means small businesses would be able to purchase health coverage outside of their state boundaries, which they currently are not allowed to do. He would further promote health savings accounts, allowing people that have HSAs to use the funds in their HSAs to actually go towards their premiums. That's currently not allowed right now. He would allow purchasing pools. As you know, small businesses have been big on the purchasing pools. Letting small businesses and individuals gather in groups and use that leverage to better negotiate for more choices and better prices in the market. And also, he would implement legal reform. That is, place a cap on non-economic damages in medical malpractice lawsuits to hopefully bring down, the cost of health care. So those are just some of the items. I mean, our small businesses, they want more affordable choices. They want more competition. And the government has to enable the competitive environment. And that's what SBE Council has been pushing for some time now. But we've even been working, and have been working with the administration on ways that they can improve Obamacare. Although there really has not been a lot of activity in that regard, unfortunately.
And there's some good resources on the SBE Council website if you want to learn more about this topic, right?
Absolutely. And again, we have the whole series of where the candidates stand on regulation, on healthcare, on trade, and on taxes. And so if you want to know where the candidates stand on healthcare, visit the SBE Council website, sbecouncil.org, and you'll easily be able to find this document.
And again, just to wrap up, I think just to clarify, I mean, many small business entrepreneurs, I mean, they care about the health of their workers. They want to provide access to affordable care. This is not an issue of, whether to provide health care or not. It's an issue, like you said, of uncertainty and affordability and fear of the unknown. And when a small business owner can't see clearly to the future, they can't plan. And if they can't plan, they can't grow. And they can't grow, they can't hire. So, these issues are all interconnected in a business strategic way.
Absolutely.